everyone. Welcome to Care Lab.
Welcome to Care Lab. I'm so excited that we are all here to have this awesome conversation.
Yes, me too. I'm going to apologize in advance for my terrible, wrinkly background. I'm in my closet today recording, and I thought it would be nicer to look at my sad wrinkled sheet than my sad messy closet. So there you go.
Understood. And all the listeners, you don't have to endure this pain that we see with our eyes.
Yeah, that's true. And it is. Did you guys iron your sheets?
Like for my bed?
Yeah.
No.
I don't.
No.
Me neither. But I know people who do.
Oh, wow.
That's very homely and awesome of them, but I just can't.
It's a lot of work.
I don't have time, unfortunately.
No. Clearly, neither do I.
So, okay. I have a question.
Okay.
We have Dr. Reshma Kapadia here, who is a pharmacist. And so because in honor of having a pharmacist here is what our icebreaker question is. I want to know, what are the things that you put into your body that make you feel better, that always make you feel better? You know, like, do you have home remedies? Do you have a medication? You're like, oh, yeah, I got to have that because it does this. What is the thing that helps you?
Well, that's a good question.
Yeah. So the thing that comes to my mind is healthy foods.
Mm-hmm.
You know, stuff like for the soul, things that help your soul, meaning quiet, peace, walks, your dog. So I take in a lot of soul enriching things in my life experiences that make me feel good. But when it comes to a medication, unfortunately, I don't have a recommendation. Unless you are having symptoms of some pain or something like that, then of course medications help. But just for a day, I think, having a good lifestyle and diet is just what that makes me feel better.
So I don't hear you saying anything about things that you want to actually ingest besides natural things, unless you have a very particular reason for it. Is that a fair statement?
Yes, exactly.
Amelia, what you got?
Yeah, I mean, I'm going to be boring and basically say the same. I mean, I definitely can tell the difference in how I feel both in my body and in terms of like my attitude and how clearly I'm thinking based on whether or not I'm putting good healthy food into my body. So like if I'm eating junk, I'm going to feel like junk. But if I'm doing a good job making good choices, healthy fruits and vegetables, lots of like fresh whole foods, whole grains, things like that, then yeah, I feel better and I think and I look better, I think, and I my mental health I think is better, and I think my thought clarity is better too. And I'm not opposed, like if I need medicine, I'll take the medicine. I'm not opposed to better living through chemistry, but I also think, sometimes the simple boring answer for me is just like, if you put good stuff in, you generally feel better too.
Get good stuff out.
Mm-hmm.
Yeah.
Output equals input.
How about you?
This is so interesting because I have a very similar answer. I really appreciate, I'm not anti-medication, but I am definitely appreciate the food as medicine concept. And so if something feels not right in my life or my body, then the first thing I like to think about is, what can I eat or drink that will help ameliorate this situation first. And then if I need to have something else, then something else. So like a good example is a headache, right? I don't have headaches that often, but if I do, the first thing is not take Tylenol. I probably didn't sleep enough, so I'm going to try to sleep, or just rest at the bare minimum. And then if I can't deal with it, then maybe I'll take some Tylenol. But for the most part, it's that. And I have somehow convinced my kids that tea solves all problems. And so if they feel like their stomach hurts or their throat is irritated or they're coughing or whatever, they don't feel good. I'm like, do you want some tea? And so tea is like a general term, the eye doctor for the situation. So if their throat hurts, it's got honey in it. If their stomach hurts, it's got ginger in it. You know, it's just like trying to use other things to help them feel better. And then they just like it because they feel like they're being babied by their mama. And so they feel better.
Mm-hmm.
Well, that's interesting you say that because in ancient areas in Eastern medicine is tea and herbal remedies,
Yep.
which was all they had in the ancient days to help or cure and alleviate symptoms that patient or people had. So it was what you're doing is actually a form of medication, a pharmacy that we used a long time ago. So that's cool that you say that because it is very helpful, and I feel like we need to go back to that too.
Mm-hmm.
Hmm.
Agreed. And like I feel like I'm for lack of better words bastardizing it because I know there's lots of science behind it and I don't know enough to really be like actually prescribing the right herbs to be doing the thing, but I have my few little things that I would use and maybe I'll
Yeah.
get smarter from here.
Yes, for sure. Yeah.
I also think that like a, a cup of tea, kind of what you were saying earlier, Reshma, it's just good for your soul. Like it just feels good. My kids are kind of the same. If they are having a hard day or maybe they don't feel good or they just want to feel like comforted, they'll ask for a cup of tea, you know? And it's just I think it's so much, especially for like kids and their moms. Like mom made me this cup of tea.
Mhm.
Mhm.
And, you know, when someone you love like does something like that for you that's just always comforting, it just makes you feel better no matter what, right?
Yep.
Yeah, for sure. Yes.
Um, so let's jump into what is, I'm sure, going to be an amazing conversation. I do want to do a little bit of a better introduction for you, Reshma,
Mm.
for folks who might not know you or might not be familiar with your work. So, really quick here, everyone. Reshma has been a practicing pharmacist for over 20 years. She has her doctorate of pharmacy from the University of Texas, which we didn't talk about that before, but that's also my alma mater.
Oh, nice.
Yeah.
Yeah. Go Longhorn.
Hook 'em
Yeah.
horns, hook 'em horns. So Reshma's passion is to help older adults navigate the world of pharmacy and decrease the overuse of medications that could contribute to adverse events and outcomes, to educate people, advocate for safe and effective and minimal treatment to prevent those adverse events and outcomes, and keep people healthy at home for as long as possible. So we're very, very happy to have you here today. I wonder if you would start us off by just giving an explanation of really what pharmacists do, because I know that seems like people know that, but I think that the knowledge and scope of what pharmacists can do is often underrated. You know, like we think of you as just like the person who doles out the pills, but pharmacists have this crazy amount of information in their heads. So would you tell us a little bit like about what it means to be a pharmacist?
Yes, definitely. And I am so glad you're asking this question because it is you know, in society, we look as pharmacists as the pill dispenser, pill pusher, um, and we have so much knowledge when it comes to medications, what they're used for, how they are eliminated and metabolized in our bodies, how they help us, how they also can cause certain side effects, which is so important to know as well when we are taking medications. Um, so there's so many different roles in pharmacy out there. As we know, there's the retail pharmacist, which is a CVS or Walgreens pharmacist that actually dispenses the medications, but they are a great resource too. The only issues with that is they don't have the time to
Mm.
really consult in an expansive way to take that time with the patient. But they do have, of course, they went through pharmacy school too, so they have the knowledge. Then there's hospital pharmacists, which also dispense medications to the patients in the hospital. And they are actually very helpful resources for the doctors and nurses there. And then I am actually a consultant pharmacist. So I work in nursing homes, assisted livings, memory care. and I do medication reviews for the patients in those facilities. And so we look at all their meds and make sure everything is appropriate, no side effect or duplicate therapy, adverse reactions, drug interactions, so much more. And then we also maintain the medications in the facility, because we educate our caregivers in the facilities on how to give the medications properly, because that can cause med errors. So there's so many roles for a pharmacist, and then of course you have your pharmacists that do research and many other areas, work in physician offices as well. So it's very wide and expansive roles as pharmacists. So I love that you asked this because it's so important for patients to understand and caregivers that we are a huge resource to them when it comes to medication knowledge and questions for so many things that their family or they themselves may be experiencing.
Okay, I have a follow-up
Mm.
question based on what you were describing as your role as like a consulting pharmacist. So, you're going in and you're doing these in-depth medication reviews for individuals to kind of, like you said, make sure there's not duplicate things on there, look for adverse interactions and things like that. I think a lot of people feel like, well, isn't the doctor already doing that? Right. And so, but so would you talk a little bit about like why does a pharmacist need to be there doing why is maybe it's not enough just to have your doctor prescribing the meds? Why do you need a pharmacist to do these kinds of reviews?
Yes. So, as we know, the healthcare system is very fragmented. And it's similar in the nursing homes. So they have multiple doctors coming in to see the patient for different disease states. So when doctors do come in, they assess the patient and they may add a medication to their profile, and that may be the patient may already be taking something similar, maybe not the same thing. It could be like a statin medication for cholesterol, and now we're adding another cholesterol medication. So doctors don't always have the time, unfortunately, to do an in-depth med review on every resident every time they see them, which is one of the reasons why it's so important to work with a pharmacist. And there's so many other factors as well when it comes to medication management in and how nursing may not be aware that these two medications put together can cause this drug interaction. The
Mm-hmm.
physician might. Again, we're focused mainly on medications through pharmacy school, 4 years of pharmacy school. Doctors get a pretty good review of medications, but our specialty is meds. So we're going to know right off the bat our drug interactions and side effects, and the patient could be presenting, fluid overload, which may be due to a medication versus a new diagnosis. So, in that sense, it's so important for a pharmacist to be involved in the landscape of medication management and patient care when it comes to these things, because we have that knowledge in our mind constantly, whereas sometimes these things can get overlooked when there multiple issues with time management, being available, being able to look at everything, or the knowledge base as well of other caregivers in the system, such as the nurse.
You so I think it's such an important point that I want to additionally drive home is that like you have 4 years of schooling towards this plus 20 years of practice. Because I don't know about you, Amelia, but when I was in OT school, we got a 1 semester pharmacology class.
Yeah.
And while I do feel like I needed to know that information, it made me acutely aware that like this is way deeper than this. And
Yeah.
I'm
Yeah.
just barely scratching the surface. And so the moral of my story is I need to refer to a pharmacist. And if you ask me a question about medication, I'm going to say, this is the
Mm.
basics, but we're going to go talk to the pharmacist about this because it just has so much depth to it. And like one thing that you just mentioned that I feel like people don't pay enough attention to is the timing of the medications. And so, can you talk a little bit about, since that lies very solely or specifically either with the patient themselves or whoever's providing the medications, can you talk to why that's so important to take at the time that it's says it's dosed at?
Yes, so that's a big reason, actually. That it's huge reason for med errors
Mhm,
in especially in our elderly population.
mhm,
Um, Understanding that a medication has requirements of when it should be given. So, and it's mainly because of the pharmacology, the way the medication is processed in our body, and that medication is made in a specific way that requires us to take it at a certain time due to the way it is moving through our body. So, to have the best effect for the patient when you do that, one of the common medications is synthroid. A lot of people are on synthroid for hyperthyroidism, and they end up, it's taken 1 hour before food on empty stomach, but they don't always know that or are not aware, or they know that and they just want to do what they feel is
They
comfortable. The
maybe
best.
they don't understand exactly how important that is to make the medication. They're like, oh yeah, I hear that, but whatever, I'm gonna do it this way.
Yes, exactly,
mhm.
exactly.
Hey there, it's Amelia. Listen, I am so thrilled to have a great resource like Ask Sammy as part of the Care Lab team, and here's why. It's a game changer for aging in place because it makes it so simple. All you do is ask. Just type in your question or even tell Sammy what the problem is and get tailored solutions. Everything from innovative adaptive equipment to comprehensive resources. It's a great way to become more empowered, to live more independently, and to live with greater confidence. And my favorite thing about how Ask Sammy works is it's deeply rooted in dignity and practicality. So, whether you're a fellow therapist, a care partner, or someone who's seeking solutions for themselves, visit www.asksammy.com. We're going to link it in the show notes so you can find it there. Start making home more accessible today. Now, back to the show.
So now the medication is, let's say, taken with food and is not working as effectively as when we were taking it the way the manufacturer needed us to take it. And so now they go back to the doctor, get a lab, see how their thyroid function is, and now the dose is increased. So then we end up getting higher doses of medications, which now can have more side effects. The higher the dose, the more side effects of the medication. So timing is huge when it comes to medications and how they should be given. A lot of patients also, if it's dosed 2 times a day, they only want to take it once a day, or they may double up because they forgot a
Mm-hmm.
medication. We can't do that. That's very unsafe. So there's a lot of education that needs to go behind when we do prescribe medications, because it's not as I feel. Unfortunately, people see the pharmacist behind the counter and the whole pharmacy system in retail as a fast food type of environment, and
Mm-hmm.
it's not. There's, like you
Mhm.
said, there's a lot more depth to it, and there's a lot more education and guidance. And then there's also the fact that once they do take the meds, they now may be experiencing another symptom and they have questions, and there's no one there to answer those questions either. So there's a lot behind medications and how we can help people navigate. this system.
And I just want to reiterate like one more time, you have 4 years of school just dedicated to medicine and
Mm-hmm.
how it works in your body and how the medicines themselves are even like built down to the chemical structure. It's 4 years just on that. Med school is also 4 years, right? But doctors have to learn, but they're learning a ton of other stuff during that time. So, and then of course, you know, there's residencies and things like that, but you're spending the same amount of time that doctors are learning tons and tons of stuff focused on this very specific issue, like getting so down into the nitty gritty nuts and bolts of it. Of course, pharmacists are really truly, even though the doctors are the ones prescribing, pharmacists really are the experts on these medications, how they work and how they work in your body. So it really, like, when you start thinking about that and understanding the difference, it makes sense that you need someone who has that level of expertise to review these medicines that really do have, I mean, they can have huge impacts on the way your body works, on how you function, and on your quality of life. I think that sometimes we've gotten really used to, like, as a culture, to like taking medicines and taking pills, and like it's been super normalized for us that if you have a problem, you take a pill for it. And so it feels like it's not a big deal, and it
Mm,
feels like it's always really safe. And of
Mm-hmm.
course, that's not to say, like, you can use lots of medications safely, but you have to be following the directions and doing it the right way and understanding that it's complicated. So you can be taking one thing, you can add another thing on top of it, and it can, and those things can interact. And really, truly, like, no one actually knows about all of that except your pharmacist.
Yes. So true. So true. And that's such an important point to reiterate to as well, because like you said, we just pop pills like candy. And it's so much more to it, and it's actually causing harm.
mhm,
And now that we have more medications in the market than ever before, um and we have, but now we have been starting to see in the last decade and 10 to 20 years how these medications are now really combining and affecting, especially our elderly.
mm,
And mainly because they're more frail and their metabolism is different than, as you get older. So it is affecting them, and research does not always include patients over 65. It's very few that are older that are included in these drug research studies before the drug comes out in the market. So we don't really know truly how these meds are affecting them. So there's a lot more depth to medications than just what we see. And I think the culture of fast fix as well has really harmed us when it comes to medications, because it may be a fast fix, but then in the future we may suffer from other consequences.
mm. You mentioned earlier about like your role as a consulting pharmacist and how more than like most of the time we have more than one physician and they are looking at more than one thing in our persons and prescribing more than one thing, but not necessarily communicating with each other or looking to see how all these things interact. And so you can see how over the years you might take a thing for a chronic disease and keep taking a thing and get added another thing, and by the time you get to be 65, 70, you could be on a lot of different medications. And so
Mhm.
can you talk a little bit about the concept of overprescribing and recently I learned that's a controversial topic of deprescribing medications, and like what that is and why that's a challenge and why people should know about it.
Yes. So, as you said, polypharmacy contributes to people and patients Being on multiple medications. Polypharmacy is defined as 5 medications or more, multiple physicians, multiple pharmacies, in multiple chronic conditions. So, and a lot of our seniors fall into a lot of those categories. So, and the way our system is, like I said, fragmented, where we have a physician for pain and we have a physician for blood pressure and diabetes. So, all of those physicians, there's no common electronic health record either, which is all leading to mismanagement or med errors, and overprescribing of medications in our patients. And so this is a huge problem. And they, so what's happening is they get a medication. Usually, if you're on 5 or more medications, you end up adding more medications due to the first original 5 because of the side
Mm.
effect of those.
Ah, okay. So
You
you're
need to
like
manage the
taking
side
another
effects
pill to solve the problems that one of the first 5 pills have caused, and then it
created.
just keeps causing more problems, and then like it just grows and grows and grows.
And that's called the prescription cascade.
Uh,
Oh, I didn't know
Yes.
that's a
that
new word.
term. Yeah,
Yeah.
that
Yeah.
is a good word.
Yes, so that is the whole point of we're on a medication. Now we're on a we're getting a side effect of one medication. A common one is pain meds. Now
Mhm.
you get constipation due to pain medications. That's a very common side effect, and now we're on a laxative for that
Mhm.
issue. So and then
Then
that
you're
can
dehydrated.
exactly. That was the next thing. Now is dehydration. So now we're going to be on something else, which could affect blood pressure. So many things in our body function as a whole, and one system affects another. And putting that all together, I think, is so important for the patient and to um, and that's one of the things I wanted to educate on and advocate for in our seniors, especially, is to ask, do I need to be on this med? Is it
Mm.
still needed for me? Or is, because we go under the impression that a med, once we get prescribed something, it's forever. And it's
Mm-hmm.
not forever. And some common things don't always even have to be forever. Like your GI medications to help with reflux. That is not needed forever, but a lot of our seniors are on that forever.
Mm.
Um, and now we're seeing dementia caused or leading due to overuse of our GI medications, some infections due to that. So there's a lot of things coming out about what, when you use a medication too long, now what can happen from that. Not only the side effect of it, but now we're seeing other results occurring because we've used the medication longer than what it was studied for. Um,
Can I just say, like, that's nuts? I actually didn't know, and I had heard recently and like read some articles about, long-term use of some of those kinds of GI meds and how they affect our gut and how that affects other things. But I had not heard that we're finding evidence that it can lead to onset of dementia symptoms. Like
mhm.
that
Yeah,
is
because
crazy pants.
yes, because it's for the gut, right? And
Mm-hmm.
so it's affecting your lining, and the lining affects what nutrients you absorb.
Mm,
So now your
Mm-hmm.
nutrients are really important in your body for brain function. And now we have some cognitive issues or um, confusion or memory loss.
Mm-hmm.
And
it
we
makes
now
sense.
get diagnosed with dementia.
Got it.
When all we need to do is maybe try that GI med and see if we can get off of it and
Wow.
get our nutrition back and see if that helps us. And instead of adding another medication for dementia.
Yeah.
Whoa.
That, and just for my curiosity, that information that's coming out now, that's after having taken like a GERD medicine for how many years? Did they say
So
like the time frame?
medication for taking a PPI, which is a medication for reflux, is about 8 weeks.
So you're saying after taking it for 8 weeks, you can
After
start to
you
mess with the lining and all the
yes.
cascade that you just
Well,
said?
that probably dementia I would assume would be a lot longer.
Okay.
But when you start talking about possibility of having C. diff,
Uh,
um, and pneumonia start occurring in patients, that may be a medication you want to look at to see,
Oh,
okay, this is now causing us to get C. diff or pneumonia, other infections. Is that possible? That let's look and see if this PPI is or the GI medication is causing that.
because it messes with the acidity level of your gut, right? So it's going to change what kind of bacteria can grow in there. And of course, like we want, our gut needs to have
Correct.
its own, like,
microbiome.
yeah, microbiome. It's got bacteria and other flora in there that it needs to have. When we mess that up, when we mess up the pH level in our gut,
Correct.
then we change what can live in there, and then that can lead to things growing that we don't want to grow. That's
Exactly.
that is so that is so interesting.
Yes.
Wow.
It's global
Yes.
warming for your gut.
Oh my gosh.
We're killing the ecosystem.
Yeah.
Care Lab listeners, it's Brandy, and as the founder of a platform made to make aging in place easier for everyone, I knew it would be incomplete if we did not have education, especially for caregivers. So whether you're a family caregiver or somebody who trains a whole organization, Higher Standards Caregiver Training videos are for you. I'm so proud that we were able to partner together with Amelia in order to provide these to you because they're easy for everybody. You get great occupational therapist-led training on topics like transfers and how to care for someone as they age, or maybe as things change when you have Parkinson's. So no matter if you're the loved one who doesn't know exactly what to do next because things are getting different, or if you're a professional who trains caregivers that go into the community and you need some quality education, you get both from Higher Standards Caregiver Training. And you need to check them out at higherstandardscaregivertraining.com. So, okay, this is my question. Now, as healthcare professionals, we see doctor's notes and we see things pass from one to another, and medication lists are in there almost all the time.
Mm-hmm.
What I don't see, though, and you can correct me if I'm wrong, is the date that you started taking that medication.
Yeah.
And so while I might know that you're on XYZ med, I don't know how long you've been on that. And it sounds like we need to be more aware of how long we're on things so that the trigger question can be happening. Even, I mean, the person who's taking the medicine should ask the question, like you said, do I need to be on this? But there's a lot of barriers to that sometimes. And so for some of us other healthcare professionals that are helping people, like we have no reason or way to know, like, maybe I should help them ask this question because I don't know how long you've been on that thing.
Right.
So is there any movement around like adding those kinds of dates to medical records, or are there ways that we can think about like dealing with that, or is it really just on the patient?
Unfortunately, right now it is just on the patient and their family to, or their caregivers to look and be asked these questions to their physician. Um, how long do I need to be on this? I think that that's a huge component that I'm trying to advocate for as well, because it is important to know how long you've been on it and how long do you expect them to be on it.
Mm-hmm.
And what alternatives can we give them to help them to possibly get off of it one day? So we talked about, the deprescribing. Um, it's such a huge thing because, like we said, the more medications you are on, the more side effects you're going to experience, and then the more meds you're going to start adding. So, we want to try to prevent that because the more meds we start adding, now our quality of life has changed. And we now are in risk for other of harm and adverse reactions that may be serious. So we want to really try to get off of meds as much as we can. Of course, there's some meds you may never get off of, and that's okay. You need certain meds to for the disease process you have, but trying to work, I think that's a huge question, is asking your primary care provider or your physician, let's talk about my meds and when I can get off of some of them because I feel like I'm on too many.
So, why is
And
deprescribing a taboo word or topic?
I think there's a lot of reasons for that. Um, when it comes to medications, one is the culture. We're just thinking that mindset. We see commercials all the time. A med is helpful for this, a med is helpful for that.
This one
And
comes with a puppy and
exactly.
great weather.
Yeah.
Yes.
And so we think it's all wonderful. But once you start, I've come across many patients who are taking some of these new meds that come out and they end up with side effects that are irreversible. And
Mm,
it's very sad. So just to be aware of, what you're putting in your body is huge. Um, and not always there is a disclaimer at the end of the commercial that, talks about the reason the serious events and it could lead to death. And so we need to pay attention to that. And so
But the
there's a
puppy,
culture.
Reshma, the
I know.
puppy. Sorry.
Yes, I agree. Yeah, I mean, it looks beautiful.
It
I
does.
agree. It does. But let's look at it as I agree, it's amazing, it's going to help you, but and maybe short term, maybe.
mm-hmm.
Um but again, you are taking a risk. Anything you put in that's chemical, that's not natural, it is a risk. And some things that are natural are a risk as well, as we know. But this is medications. It's chemically made. It's not just without harm. So we have to always be aware of that. Then there's the issue of timing with being the time you get with your physician. They're not always thinking about taking medications off. So they have been, and we know medical schools teach you about, and even pharmacy school, we really didn't learn about deprescribing. It
Mm,
was more like this medication is used for this, and this is how it's taken. This is how it works in our body. These are the side effects. But there was, of course, there's recommendations on how long it should be given, or it was studied for this amount of time. Um, but there's no one really thinking about, oh, okay, you've been on this med for this long, so let's take it off. Some of the common ones we know about are like our antibiotics. We know those should not be taken forever. But most other meds, we don't think about that. So I think it's just putting that thought in everyone in our healthcare system and saying, let's think about, what we can take off. And has the patient's symptoms subsided or gotten better? Can we decrease the dose? Um, so I feel like there's a lot of barriers for deprescribing. There's also the patients want something. They feel that placebo effect
mm-hmm.
Mm-hmm.
is huge, that they feel like that, oh, if I get off of it, oh, my blood pressure will come back, and it's just that mindset. So it's also helping patients understand that you can do other things to help with your blood pressure. You don't always have to be on a medication. And sometimes those things are hard work, whereas a medication is easy. It's easy. And that's another issue with deprescribing is they don't it's just an easy fix and people like easy.
Mm-hmm.
Mm-hmm.
So yeah, and it's just also maybe with physicians and a pharmacist, malpractice issues, so that's huge as well. um, because if you give a medication and it helps them, you're good. But if it has a side effect, I mean, you really can't do anything as a patient to the physician. Whereas if you don't add a medication and something happens or take away a medication, now it's malpractice.
That's really interesting, and I hadn't necessarily hadn't thought about it from that angle, probably because, like, as an occupational therapist, I can't, other than having some like scratch the level surface understanding of what medications do what, so I know what I'm looking at in a chart. I can't prescribe medications, I can't handle medications, I can't make recommendations for medications because it's outside, so far outside of my scope of practice and level of expertise. So that's not really a perspective that I had thought about before, but yeah, that makes sense.
Yeah, yeah, and that it was so you would really need that patient to be on board
Mm-hmm.
with what your plan is for them for
Mhm.
with their medications, and understanding that we want you to be on a optimal drug therapy with the benefit outweighing the risk. Are you on board with that? Are you, and if you start experiencing symptoms, we can always add it, but let's try to keep you off of it or have alternatives. And so it's really I feel like patients who really want to live a certain lifestyle and try to prevent harm when it or possible harm due to medication side effects or adverse events that are really unfortunate due to overuse of medication. So it's, I think, more going to be a collaboration between the patient and the physician and pharmacist to make these decisions if that's how they want to proceed. So many people do want a fast fix, unfortunately. So it's not going to be for everyone right now until our healthcare system changes and there's policies implemented and
Mm-hmm.
safeguards, and then I feel this will be easier to do. But right now, with the way it is, it's definitely going to be a collaboration approach.
I have one more question. If it feels like too sticky, you can dodge it. But my question is there a particular point, like reason? Is there a particular reason that you can pinpoint, I guess? It's okay if there's not. Why we don't also prescribe food and natural substances. So,
Mm.
for example,
Mhm.
a doctor might prescribe like vitamin C or vitamin E or something like that, but also we get that in nature from other places, and our bodies absorb it through food a lot better, or maybe better is not the right word, but in a different way. It metabolizes better when it comes through food or through the plant that it came from. Are there any particular reasons why that's not a part of the prescription system, if that makes sense? Of like,
Mhm.
we'd like to have a thing, an action to take. I feel this way. I'm coming to the doctor. Help me. And then right now they give you a drug, but they could also maybe give you a prescription for some kinds of foods or some other kind of tea or some, like other things. What thoughts you
Yeah,
have about that?
I feel that's more because um, as a pharmacist, and I'm sure as a physician, that, just going based off of pharmacy school, we are not taught that.
Mm,
We are not taught food as medicine. It's all about medications, and this is the studies, and this is what the research has shown, and this is how this medication works for this disease state. So this is what you prescribe, and this is the treatment time. It's really, I think, a thought that a lot of people don't come out thinking out of medical school because we're not it's I've really learned this as a pharmacist practicing in the environment, throughout my 20 years of experience.
hmm
I started realizing, I'm obviously, my parents are Indian, so we did a lot of Eastern medicine, herbals, natural things. If we had a headache or leg pain or something, my mom would, rub tiger balm on us, or, just those natural remedies, or give us turmeric and honey milk, things like that. So I kind of already knew there was some benefit to those things. And I feel our culture has always been medication, highly influenced by meds versus natural. So I remember when I first came out of pharmacy school, I would be like, "Oh, that stuff doesn't work, mom. Just we just take a medicine, because I
hmm
came out of pharmacy school, so
Yeah.
I'm like,
hmm
And then I started seeing the harms of medications and side effects. And I was like, oh, okay, maybe this is not as good as I thought. And then I went back to seeing what my parents did and realized there was benefit from it. It's just not the immediate benefit
Mm-hmm.
or it takes longer to see benefit from a not something we put in like food versus a medicine. Medicine, you're going to feel pain relief right away.
Mm-hmm.
Mm-hmm.
Whereas not changing your diet or exercising, you may not see that relief for a little while. So, I feel that's one reason why is that we're just not taught that.
Mm-hmm.
And the relief of that is a lot, it just takes a lot longer to see relief or symptoms subside due to food. The time frame is longer, and not everyone I think is willing to do certain things to um help them decrease, let's say, blood pressure. Like I know a lot of cardiologists or even primary care doctors will ask, when they first start seeing high blood pressure, they'll say, okay, let's try a diet, low salt diet for 6 months and then come and see me. Majority of the patients end up, not doing the low salt diet and their blood pressure is high still and they start meds.
Mm-hmm.
So I feel the importance of it, or, I feel there should be um, more guidance to the patient when it comes to advocating for other non-pharmacological approaches to management of their disease state, because we may just offer, for example, the low salt diet, but does the patient really understand what that means?
That's what I was just going to say
Yeah,
is like,
not
I think
really.
all of this comes around to being an education issue, right? Because like you
Yes,
could say low salt diet, but does the patient know that when they read a label that sodium is the same thing as salt? And they might
yes,
not. And
Mm-hmm.
yes,
so if they might think that they're on a low salt diet because they're not salting their food,
They're not putting salt on it. Yes.
but
cor-
they're actually still eating a ton of salt because there's so much sodium in the processed food that they're eating. So I think, and I don't think that means people aren't dumb. I really truly believe that. I think people are smart, but if you don't give them the information that they need to make good decisions, then it's very difficult to make
yes,
those
Yeah.
yes,
good decisions. And we can't assume based on our knowledge that what we're saying makes any sense at all, because it
correct.
probably doesn't. Like, we
Yes,
have to think about it from their perspective. We have to be willing to take a little longer in a conversation
right.
to have them talk to us and listen to what we're hearing instead of just us talking at them and
Hmm.
giving information, so I think, and I mean, partly I think that as an occupational therapist, that's one of the things that I try to do a lot, because I don't have meds in my, like, that's not in my pocket. It's something that I can give out. Everything that I quote unquote prescribe or recommend for someone is going to be a functional approach. It's going to be about it because I can't use meds. That's not in my pocket. So it has to be about lifestyle changes, behavioral changes, modifications. How are we going to do X, Y, and Z? And it is really hard, as you pointed out,
Mm,
to get people to do those things. It's
Yep.
really hard, but it makes it a lot easier if you
yes.
actually tell them why and they understand the why. And then it's like, oh wait, you mean if I change this habit, I'm going to feel better, like, all the time?
Mm-hmm.
Yeah. And then people
Mm-hmm.
can get on board with it. But I think so often it comes down to this idea of, are we really truly educating people in a way that
Yes.
is speaking to them? And that's why I think the work that you're doing is so important, because you are having those kinds of conversations with people about their medicines and really helping them understand the nuts and bolts of this isn't just a thing that you put into your mouth. It's something that you're an active participant in,
Mm,
and let's understand this better together.
Yeah.
yeah, for sure. Yes, it's so important to have these conversations. And the other point I wanted to make about um, educating as well as follow up. There's no follow up after we
Yeah.
talk to them and make a recommendation of a low salt diet. I feel it's so important to have caregiver, the physician or nurse call the patient and say, "Hey, how's it going? And do you have questions about your diet? How can we help you?" Because it's not as easy, like you said, as just 2 grams of salt a day. Okay, I don't,
Yeah.
and we could actually help prevent medications being added by just that one phone call and having the opportunity for questions.
Well, Reshma, thank you so
Yeah.
much for
So much.
being on Care
Thank.
Lab. I there's so much more that I think we could talk
Yes.
about. I would love to have you back again in the future if you're up for that, because there are
Yes.
like so many rabbit holes that I wanted to go down today that I didn't go down because I didn't want to derail everything. But I would love to have you back. We would love to have you back if you were up
Yes.
for it.
Yes, this was awesome, and I'm so glad you guys invited me. This was a great journey, and I'm glad I got to educate a little bit and talk about what I love.
Well, listener, if you enjoyed the episode, please make sure that you are liking and clicking that little button to subscribe so that you get updates on whenever the next Care Lab podcast drops, which is, by the way, every Friday.
Every
Just in
Friday,
case,
not a
every
secret.
Friday, just in case you didn't know. Make sure that you're sharing this with other folks who you think could benefit from the information. And we will see you next time right here on Care Lab.
Bye.
Bye.